Well, I'm going to talk today about the transfer of medications into human milk. Most of you are probably not primary care providers and you don't take care of babies, but many of you probably do take care of women, and if they are within childbearing age, some of them may still be breastfeeding or lactating while you are taking care of them. And so I'm hopeful that I'll give you, today we're going to just talk about to understand some of the mechanisms by which drugs enter breast milk, discuss some commonly used medications and their safety in breastfeeding mothers, and review some good sources of information on medications and their safety in breastfeeding mothers. And we're also going to just overview sort of the importance of breastfeeding and why it's important and why human milk is important for moms and babies. Breastfeeding in general, we know that breastfeeding is a biologic norm for all mammals. It is the gold standard for human infant feeding. The American Academy of Pediatrics recommends breast milk only for the first 6 months of life. That means nothing but breast milk, no water, no tea, no juice, nothing, just breast milk, and medications if necessary. Mothers should be encouraged to breastfeed for 12 months with the addition of complementary foods. We do recommend after 6 months starting fruits, vegetables, proteins, etc. There are immediate health advantages for the baby. Essentially, every infectious disease is lowered by breastfeeding. Babies that are breastfed have lower risks of diarrhea, pneumonia, otitis media or ear infections, meningitis, and necrotizing enterocolitis. Necrotizing enterocolitis is a disease primarily of newborns where they have necrosis or part of their gut dies off. It's not clear what the etiology is, but we know that babies that are breastfed are at lower risk for NEC or necrotizing enterocolitis. There's also long-term benefits. There's a lower cumulative incidence of acute otitis media. So breastfed babies, not only do they have lower risks of an ear infection while they're breastfeeding, but that protection continues throughout their entire life. They also have lower rates of leukemia and lymphoma, obesity, part of one of our systems. So encouraging breastfeeding would be part of our systems approach. Lower rates of type 1 and type 2 diabetes, eczema, and they also have an enhanced response to vaccines. We can't leave the mothers out. Mothers also have increased health benefits from breastfeeding. Mothers who breastfeed have lower postpartum bleeding. They have a faster return to their pre-pregnancy rate. They have lower risks of many cancers, including breast cancer, ovarian cancer. They have lower risk of metabolic syndrome. And the oxytocin that is released, oxytocin is a hormone that is essential for breastfeeding, for labor. This hormone that's released works on the brain to increase overall sense of well-being. Any questions about benefits of breastfeeding so far? Okay. So when we talk about the medication risks and benefits, it's usually pretty straightforward. We usually think about do the benefits of giving this patient this particular medication outweigh the risks that might be associated with it? Usually pretty straightforward. But when we're dealing with a breastfeeding mother, the risk-benefit ratio gets a little bit more complicated because you have to include not only, is the benefit of treating higher than the risk of giving the medication, but what are the benefits that breastfeeding provides for both the mother and the baby that we just reviewed? What are the benefits of treating the mother's condition against the risks of mom not taking the medication? Again, our traditional risk-benefit ratio. What are the risks to the child if mother takes the medication and she or he ingests the medication through the breast milk? And what are the risks of introducing formula? If we go back to our previous slides, if we do the reverse and we think, well, if there's a benefit to breastfeeding, meaning breastfeeding lowers the risk of otitis media, that means that if I introduce formula, that increases the risk of otitis media. So all the things we just talked about, when you add formula or when you feed a baby formula, you increase their risk. You increase their risk of obesity, you increase their risk of diabetes, etc. What are the risks of formula? It undermines breast milk. When we tell moms, do you want to just formula feed your baby? It's fine. It gives the impression that they're the same, that formula and breast milk are the same, and we know that they're not. It undermines the breastfeeding relationship. If any of you have breastfed, you know that there's a very intimate relationship. There's a very intimate bond between the mother and baby. And when you discount that, then it really undermines that relationship. What is the psychological effect of pump and dump? Again, anyone who's had to express breast milk and save it and give it to their baby while they have to go away to work, if you ever have to do that and then dump it out, psychologically for some women that's very difficult. Not some, most women, it's very difficult. It prematurely initiates the weaning process. Anytime you start to decrease breastfeeding, babies start to wean. And then again, the health risks associated with formula feeding. Is exclusivity important? Yes, exclusivity actually is important. It does matter whether you give a little bit of formula here or there. When they looked at infants exclusively breastfed for 4 versus 6 months, this means babies that got nothing but breast milk for 4 months and got nothing but breast milk for 6 months. The babies that were breastfed for 6 months still had lower rates of gastrointestinal disease, otitis media, pneumonia, and atopic disease, which eczema is a part of. Atopic disease is like eczema, allergies, asthma, etc. And mothers who breastfed exclusively for 6 months had a longer delay of return to menses, and again, improvement in their postpartum weight loss. So just some general medication rules when you're talking about breastfeeding moms. The vast majority of drugs are safe. By and large, if you're giving a mother a medication, especially if it's one that we use in pediatrics, it's safe for that breastfeeding mother to continue to breastfeed on that medication. You always want to ask yourself, is the drug therapy really necessary? Because we don't want to give medications unnecessarily. You want to determine if the drug is absorbed from the GI tract. In pediatrics, we use a drug called Miralax a lot. It's for constipation. Anyone who has a toddler knows they get constipated. And so we give them Miralax. It has very limited GI absorption. So a mother who may have to take Miralax for some intermittent irregularity, that shouldn't be a problem. You want to review the data on the drug, and we're going to very briefly go through some data, there is, and I'm just going to give you overall categories of data without going into too much detail. And then you want to choose drugs that have a shorter half-life, with the caveat to be careful of drugs whose active metabolite have a much longer half-life. Just because if a drug goes through, sort of Prozac is our classic example of that. Prozac actually metabolizes very quickly, but it has an active metabolite that has a very long half-life, and it's really not recommended for use in breastfeeding moms. Oh, I didn't change my scenario numbers, apologize for that, but here's a scenario. So we have Mrs. Peel, and she calls the office because she was seen in the emergency room. I think this is, okay. She was seen in the emergency room last night, and she was prescribed Levaquin, which is a fluoroquinolone, and prednisone for bronchitis. She was told by her emergency room physician to stop breastfeeding while she was on the Levaquin, and she would like your opinion. So without a show of hands, you guys can just keep it to yourself. What do you answer? Of course you can breastfeed. There's no problem breastfeeding on these medications. I don't know offhand, but I know where to look. I don't know, better not, or no, it's not safe to breastfeed on metformin. Oh, I changed, sorry. It's not metformin, it's Levaquin. You should formula feed. Well, I think for the majority of us, me included, for many medications, I'm going to say, I don't know, but I know where to look. So let's look at our resources. So this is the classic resource for looking at medications in mother's milk. This is a book by Tom Hale. He publishes them basically once every 2 to 3 years. And he has separated each drug and given each drug a lactation category. Lactation 1 and 2 are pretty safe, 3 moderately safe, 4 and 5 possibly hazardous, and 5 is contraindicated. Now 1 and 2, those are pretty straightforward, they're safe. 4 and 5 possibly hazardous and contraindicated. Most people would be like, yeah, I'm not so sure about this drug. Maybe we should think about some alternatives, other drugs, not breastfeeding. But it's the 3 that gets most people into, really makes them uncomfortable. Because it says moderately safe, what does that mean? And even Dr. Hale's book says, when they're talking about these categories, says that there are no controlled studies on breastfeeding women. However, the risk of untoward effects to a breastfeeding infant is possible. Or, because it's 2 different categories, or controlled studies show only minimal non-threatening adverse effects. Well, if someone's not comfortable dealing with mothers who are breastfeeding and giving their babies medication, this makes you even more uncomfortable. And then it says drugs should only be given if the potential benefit justifies the potential risk to the infant. So one of my criticisms of this book is that many of the books fall into this L3 category because there is no data, and then it doesn't really help you that much. Just to overview what are the contraindicated drugs, most antineoplastic drug therapy, chemotherapeutic agents, etc., iodine-131 and iodine are absolutely contraindicated unless it's for radiation exposure. When we had, not we, but when there was the nuclear disaster in Japan and mothers were routinely being given iodine, breastfeeding mothers, the questions came up, is this iodine safe for breastfeeding mothers to give? Well, yes, actually it is, because the babies have also been exposed to the radiation. And we want the babies to be given the iodine through mother's milk. Tom Hale also supports a website called the Infant Risk Center. It's a web forum where thousands of drug and breastfeeding questions have been answered. Anyone can access it and look at the forums and see what has been answered. But you have to register as a healthcare professional in order to post a question. It's intended for support, and not substitute for the book. So another criticism I have of it is that many of the answers you get are very short and not detailed, and it says, the answer is in my book. And if you don't have the book, for those of us that are in lactation, we have the book. I may not have it with me. Someone's calling me. I want to look quickly on the website, and I'm still not able to get an answer. For people that are interested, there is an iPhone and an Android app for a cost, and the website is there. It's at infantrisk.com. And this is basically what the forums look like, and you just search through. The forum I really like is called LactMed. It's a drug and lactation database. It's a peer-reviewed, fully referenced database of drugs in which breastfeeding mothers may be treated. It includes data on maternal infant levels of drug, any possible effects of breastfeeding and lactation. I also really like that it gives alternative drugs to consider. So right there on the site, if you scroll down to the bottom, it gives you sort of like, well, this medication hasn't been studied, but here are some other drugs that are very similar, and so you can use the data, or it says, these are alternative drugs to consider because this medication isn't recommended, so consider another medication. And this is the website. It's through ToxNet, which I also highly recommend. It's a very good site talking about just poisons, heavy metal exposure, etc. And I never remember this, so I usually just put it into a search engine, LactMed, and it gets me there. This is what it looks like. And now we're just going to go into a couple of specific examples. So let's go back to our levofloxacin and our prednisone and see what happened. I'm also going to give you some comparisons to what some other websites use so that you can see that without a good resource, you may not be getting the best information. So I don't know if you guys are familiar with UpToDate. Students love UpToDate. Some of our residents like it too, but the students absolutely love UpToDate. So we're going to type it into our search engine. And here is where, in the UpToDate, you get all of the breastfeeding information. And just to give you sort of a close-up, it says, enters breast milk, not recommended. Bummer. And then sort of breastfeeding considerations. Based on data from a case report, small amounts of levofloxacin are excluded in breast milk. Breastfeeding is not recommended by the manufacturer. Manufacturers only recommend things that they've studied on. So if they haven't studied it in breastfeeding women, they're not going to recommend it to be safe. And then it goes on to sort of to give more details. So let's, as a comparison, look and see what ToxNet says. So one other nice thing, this is sort of what you find when you see the medication in ToxNet. One other nice thing that I like about LactMed is that it gives you a summary. Like, trust me, all this down here, there's a bunch of information on studies, but if I just want a quick answer, it gives me a really nice summary at the top. And what you see here is short-term, and it summarizes all this, as short-term use of levofloxacin is acceptable in nursing mothers. Avoiding breastfeeding from 4 to 6 hours after a dose should decrease the exposure to the infant. Maternal use of an eye drop that contains levofloxacin presents negligible risk to the nursing infant. Well, I find this much more useful because it gives me some information. It gives me something I can discuss with the mom, saying, this medication is probably safe, should be fine. These medications, by the way, this entire category of medications is, according to the American Academy of Pediatrics, safe for the use in breastfeeding mothers. So it gives me some information to give to the mother. If you want to be safe, take the medication right before you go to sleep, and then by the time the baby wakes up, 4 or 5 hours later, it should be fine. Here's another scenario. How are we on time? I put this other scenario in, but if we have time, I can skip it. Okay, so this was actually a real patient of mine, and talking to the nephrologist, actually all of them are real patients of mine, but talking to the neurologist, because this is a neurology patient, it's something that they see quite often. So Mrs. Smith comes to see you for her son's first newborn visit. He's 2 weeks old and breastfeeding well. Mrs. Smith is concerned because she has multiple sclerosis and is taking Copaxone, and was taking Copaxone until she became pregnant. Her neurologist is unsure about its safety in breastfeeding mothers. And what do you think I said? I said, I don't know. I'm not a neurologist. I had never heard of this medication before. So the first thing I did was I looked it up. And I found that the name is galactomyr acetate. It's found to reduce the average relapsing rate in people with relapsing remitting multiple sclerosis. It's comprised of 4 amino acids. And it's a self-administered daily subcutaneous injection. And it's got a huge molecular weight. So to give you a little background, so obviously we talked about the oral bioavailability, or whether it's ingested from the GI tract. Same thing goes for subcutaneous injections. By and large, medications that are injected, if they were orally bioavailable, if you were able to take it by mouth, you wouldn't have to inject it. So that made me feel good. And then it's a rather big molecule. Again, very hard to get into breast milk if it's that big. So micromedics, anybody here ever use micromedics, right? This is our own site. This is what we use. So let's see what micromedics said about Copaxone. I looked it up, and it said, Thompson, this is their Thompson scale, infant risk cannot be ruled out. I've never heard of Thompson. I've been working in lactation for 15 years. I've never heard of Thompson. I have no idea who this person is. I don't know where they came up with this risk. So let me go back to let's just review up to date, just because it's so popular. It also says, excretion in breast milk is unknown, use caution. Again, luckily not one of my go-tos. But comparing what LactMed said, there's no data on the use of galactomyr acetate during breastfeeding. Okay, any galactomyr is probably destroyed in the infant's GI tract and not absorbed, except perhaps in neonates. Well, that's a little more helpful. And so now I can go back to my patient and tell her it's probably, not absorbed. It's probably destroyed. I read another place on it that I didn't include here that it probably is just broken up into all of its parts, which are just amino acids, which are part of proteins and not unsafe for anyone. So you can go back. The baby's no longer a neonate. It's beyond 2 weeks. If she wanted to wait another 2 weeks if she needed to, so that she's clearly outside of the neonatal period to begin her medications. So just to conclude, most medications are safe for the breastfeeding mother. Use available pharmacological data to guide your decision. There are some good resources, hopefully I showed you a couple, to guide your decision. Always remember that breast milk does not equal formula. And you want to work with the mother's healthcare provider. If you're not taking care of both the mother and the baby, work with the mother's healthcare provider to make alternative choices if necessary. And of course, I didn't put my contact information here, but if you do have a patient, and if you want to ask me a question about medications, I'm always available.